Welcome to the Community Spotlight Podcast. My guest today is Josh Rich with CenterWell Home Health. Welcome back.
Good morning, Dave. I appreciate you having me on again, and I appreciate the opportunity.
Well, you had the good fortune of having Randy Bigley that interviewed you last time. Today you get a different guy.
Right.
That's all right. So we like the variety is the spice of life.
I like it.
You like that as well. Now, CenterWell Home Health, I know you folks are affiliated because you're actually a part of Humana, but
Correct.
that doesn't mean you have to have Humana insurance to get your...
Exactly, and we touched on this last time.
Yeah.
We rebranded as of September of 2022, so it's been a little over a year. But you're exactly right. Humana does own us. However, we accept not all, but most major insurances. So I do want to dispel that you don't only have to have Humana to accept our services.
Okay, that's a good place for us to start. Now, I'm assuming that we've got people, this is the first time they've seen this podcast. They're saying, who is this guy over here? Who's the other guy interviewing him?
Right.
So what is CenterWell?
So CenterWell Home Health provides skilled home health services. And what I mean by that is we can provide skilled nursing care that we have a team of RNs. We have one LPN. And then we also provide physical therapy, occupational therapy. We have a medical social worker, and we have home health aides. So our goal is to provide services to mainly seniors in the community following maybe a setback medically, whether it was an actual hospitalization or maybe a need was identified before that, to get them back to their prior level of function.
Okay. Now, so home health is obviously in their home.
Correct.
But sometimes you have to do things in facilities, don't you? So
yes.
How does this work?
It's wherever you call home,
Okay.
Which that would also include here locally in Bucyrus, Carlisle Place, it's an assisted living,
Yes.
as well as Orchard Park assisted living. We can provide services in those facilities as well, but as you mentioned, in a private home, we can provide all those services I described. A lot of times in the assisted living facility, they have nursing staff, so we would get involved if there is a wound that is not healing, more of a skilled nursing need that is beyond what an assisted living nursing staff can provide. But a lot of our referrals out of those facilities are physical therapy and occupational therapy because they don't have those staff
Services
members.
that
Correct.
are available for that.
Exactly.
But then you're in places you go like to Legacy and various other ones. I know you're involved in this community.
I am.
So maybe you might want to share that. So they're not just here to. There's more to this than the business side.
Right. And
okay.
I'm happy you brought that up. We do partner with Legacy of Bucyrus, formerly ProMedica, and then also AltraCare. In those cases, we don't provide services in their building because they have nurses and therapy staff. However, we do provide services upon discharge, whether that be in their home or an assisted living facility. But what I like a lot about my job, I'm in the business for referrals. That's my main job, but I do get involved with a lot of their events. This Thursday, I know Carlisle has a trunk or treat event. Orchard Park had a cookout that we've done. I partner with Michael Dwyer from Gentiva Hospice to provide hamburgers and hot dogs, and it's just a fun event to get to know their residents and their families. We donated pumpkins to Legacy. I donated some candy and gift basket for AltraCare. So it's just nice to be a part of the facilities that we partner with and team up with.
Well, that tells you a lot about the people that you work with. Because to me, wherever you put your time, treasure, and your talents.
For sure.
And because there's a lot of people, they talk a big talk,
right,
but they don't really follow through with a lot of things.
Right. We want to be a part of the communities that we serve.
Yes.
Not, we have a job to do, but we love to do things above and beyond.
Now, I wanted to comment on something here. The last time you were here, you left a guide. It's called the Guide to Patient Services from CenterWell.
Yes, sir.
And I liked it because it listed the types of comprehensive care that you did. It said skilled nursing. I'm going to just read these so I won't skip any of them. home health aid services, physical therapy, occupational therapy, speech therapy, medical social work. These are the types of services that CenterWell can provide.
Yes.
And what I am impressed about what you're doing here is that you'll have pretty much, there's going to be consistency in who sees this patient, correct?
Exactly. Again, I'm glad you brought that up. All of our staff are CenterWell Home Health staff members, so our communication is great. We have a morning call every morning to review patients that we just initiated services on the prior day. Then every Thursday we meet as a team, and going along with that, we have a couple PTs. Actually, they have their doctorate in physical therapy. We have a couple PTAs. So CenterWell as a whole, we're a big company as far as across the nation, but we operate like a small business here in the community because our patients are going to know who's going to see them the next time. And ultimately, we're here for the patients to get them better, and we like to make that process easy for them.
This is a very important personal care issue.
Exactly.
And this is a very personal business. Both my parents have passed.
Okay.
So I understand this because as there's a time in your life you're going to might need these services.
Right.
Maybe you're a caregiver listening to this podcast out there and you say, hey, I didn't even know this was available. Well, guess what? You can call Josh.
Right.
Josh, how would they get a hold of you? Now, before I get into that, because I did my homework before I kind of come on here, but my understanding is you're out of Marion.
Correct.
But you service Bucyrus area
Yes.
out of the Marion office,
Yes.
correct?
Correct.
Now, if you're listening and you're in Gallion, they can also have CenterWell, but the office that services that is out of Ontario. Am I correct?
Correct. But
But they
Kelly,
could call you anyhow.
for sure. I can help coordinate any referral.
Okay, that's what I wanted to get into. Go ahead and give your information there.
Yes, our office number is 740-383-5400. Our internet address, for lack of a better term, is CenterWellHomeHealth.com. But something that I want to touch on that you brought up, if you are a caregiver for a loved one at home who is currently living at home or in an assisted living facility, and you notice a decline, again, I want to emphasize that a referral does not need to come from a hospital or a nursing home.
That's a good point.
If you identify the need, contact the patient or loved one's doctor, and we just need a doctor's order. We would need the patient to see the doctor for a face-to-face visit, but it's a really simple process. Let's identify that need before that hospital stay.
Your job is to take away the hurdles.
Exactly, yes.
Because the object is to get the patient better.
Exactly. And there are times where we can't accept a referral, whether it be the insurance or, staffing can be a challenge. Fortunately, we do have a new nurse starting on Halloween who lives right here in Bucyrus, so I'm very excited about that. But as I was touching on, if for some reason we cannot accept a referral, I've got contacts and I can get a hold of another agency. I want to be kind of the general contractor, so to speak. When you have a need, I want to solve, be a solution to your needs. So
that's a good point, because solving problems that's how you be. I don't care what business you're in or whether you're a business, whatever you do.
Right.
That's where you get success.
Right.
Because if you can solve somebody's problems, they'll beat a door to your path.
Exactly.
And a lot of times when you're thrown things, a lot of things with health and the elderly, sometimes it just happens.
Right.
And it's right now, and now what do I do?
Exactly.
And so that's when you need to get on that phone and give yourself a call.
Right.
I mean, and again, my guest is Josh Rich. He's with CenterWell Home Health. And would you slowly give again your phone number?
Office number 740-383-5400. And I also invite you to go on Medicare.gov and do a home health compare.
That's a very good point.
A lot of us, like you had touched on, we're not, as prepared as we want to be. We don't plan to go to the hospital. So sometimes you're in a dire need. You may not have the time to do what I'm suggesting you to do, but if so, go to Medicare.gov, do a home health compare. You can put the zip code in or Bucyrus or Galleon in, and it'll bring up all the local agencies and their star rating. And if you don't have a dog in the fight, or I'm not sure if that's the right phrase, but if you're not aware of the different agencies, why not go with who's rated best? And that'll provide, great information for you to make that decision, because you have that choice. When you're at the hospital, when you're at the nursing home, you can choose who you want. You don't have to go with who they suggest.
Yes. And an informed consumer is a consumer that makes good choices.
Yes, Dave, yes.
And I always say that because sometimes, like you said, people feel under pressure and they take the easiest line of thing and they say, well, they're going to do it, so I'll just do it.
Right.
But they're your loved ones. If you're a caregiver, you need to, it's just more than, I got an immediate problem. Yeah, you might have an immediate problem.
Right.
But you want to make sure it's to the standards and the quality that you would like your relative or your family member to be treated in.
And if you are signed up with an agency and you're not satisfied, you can change.
Yes.
You can explore other options once your loved one is home and you come to the realization that they're home, and you can now think, because you're under so much stress to make that decision. Mm-hmm. If it doesn't work out, you can give me a call. There are options. There are options, exactly.
All right. Josh, anything else you'd like to share today?
I don't think so. Have a wonderful fall, everyone, and enjoy your families come Thanksgiving and the holiday season.
Well, I want to thank you again, Josh Rich from the CenterWell Home Health, for coming on the podcast. I hope to have you back again in the new year. And as we start the new year, and again, please check this out. You owe it to yourself and to your loved one. You never know when you're going to need these services, and something like this, I can tell you, will happen right out of the blue.
Right.
And so if you can do a little prep, folks, it would help you. You might not think it's right around the corner, but sometimes the corner is a lot quicker coming up on you than what you figured.
Yes, sir.
Thank you so much for being a part of the podcast, and again, the great work that you folks do, and thanks for also being a part of the community and a part of the helping people to get through a lot of very problematic things in their life, especially when your health.
Thank you, Dave, for the opportunity.
Okay. Thank you very much.